Hello, Assalamu alaikum. My name is Dr. Ashik Sainu. I'm a Senior Consultant Gastroenterologist and Director of Endoscopy at Aster Raffah Royal Hospital. I'm here with all of you today to let you know that we are starting our third Space Endoscopy services. We are one of the endoscopy units in the country which believes in bringing a new procedure into the country almost on a yearly basis. Most of you in the gastrointestinal field would be aware of what third space endoscopy is, but this video is meant to get the message across to majority of the medical professionals in the country and outside the country. So let me tell you what third space endoscopy is. So we all know what is first space. First space is a space like your esophagus, your stomach, your colon, where most of the conventional endoscopies are done. Second space is something which surgeons see more often than us, which is ascitic, which is the peritoneal cavity, the pleural cavity, etc., which is known as the second space. Third space is actually a virtual space which exists between the lumen of your gastrointestinal tract and the second space, or the peritoneal or the pleural cavity. So let me elaborate that with a slide where we can tell you. Look at the slide. You can see on the first cartoon, you can see the endoscope actually going between the layers of the esophagus, between the mucosa and the wall of the esophagus. So we are able to create a virtual space and tunnel through that to reach the targeted space and do the necessary treatment required for a variety of diseases. So POEM, or peroral esophageal endoscopic myotomy, is a procedure which is done for achalasia cardia, where the lower esophageal sphincter is spastic. This procedure can be adapted for a lot of other conditions, including jackhammer esophagus, spastic esophageal disorders, esophageal diverticulae, certain types of pharyngeal diverticulae, etc., where the procedure can be adapted. Here is a slide which shows you how it is actually done in a real patient. Now, we talked about different indications in the esophagus, but there are other indications in the stomach, like gastroparesis, which can be due to a variety of reasons, where the similar principle of POEM can be applied to a procedure called G-POEM, or gastric POEM, where we can divide the spastic muscles of the stomach to relieve the gastroparesis. And the same concept can be applied in the colon, where the spastic muscles of the colonic musculature can be divided to give some relief to Hirschsprung's disease patients. Now let's look at the next slide, where we are introducing a concept of endoscopic full thickness resection. It forms a part of the spectrum of third space endoscopy, but this is useful to treat diseases, or especially early cancers, completely endoscopically without requiring surgery. Common indications are leiomyomas of the esophagus, cysts in the esophagus and the stomach, neuroendocrine tumors in duodenum, neuroendocrine tumors of the colon. These are all indications where endoscopic full thickness resections can be utilized. I am happy to let you know that this service is available with us from February 17th onwards. Let's look at what are the other indications in third space. So endoscopic submucosal dissection forms an integral part of third space endoscopy, where early colonic cancers, early gastric cancers can be treated. Gastric mucosa being undergoing ESD, as well as a colonic tumorous lesion undergoing ESD. There are various techniques in ESD. Pocket creation method is one of them. So where all can we do endoscopic submucosal dissections? The indications are large, but the most common ones in the esophagus are Barrett's esophagus with dysplasia, early gastric cancers, gastric subepithelial lesions, duodenal neuroendocrine tumors, colonic neuroendocrine tumors, complex colonic polyps, lateral spreading colonic tumors, and early colonic cancers, which can be treated with the endoscopic submucosal dissection. Let me introduce you to our team, which comprises 3 senior consultants and specialists in the department. Third space endoscopy services would be led by Dr. Anmol Bapaye, who is a world-renowned third space endoscopist, who will be leading our team going forward. We expect to have all your support, and we are happy to offer you the services starting February 17th onwards. Call us at 72-730-730 if you require any third space endoscopy services. Thank you.